We'd like to go over some knee examination techniques for checking for instability of the knee. The first would be just an anterior posterior drawer test where the knee is taken into just a little bit of flexion, and then by doing an anterior posterior drawer testing, also known as a Lachman's test, we can check for stability of the anterior cruciate ligament. This can also be done with a knee inflection, with internal rotation, bringing the knee back to see if there is any laxity in the ACL, and also rotating externally to see if there is instability of the anterior cruciate ligament. By flexing the knee up and pushing back, allowing for relaxation, we can check to see if there is a sulcus sign in the area just beneath the inferior pole patella, which would suggest a posterior cruciate injury. There is also what is called the flexion assisted drawer test, which also tests for the integrity of the posterior cruciate ligament. The way this is performed is by allowing flexion of the leg, of the hip, supporting the posterior aspect of the femur, and allowing therefore the proximal tibia to fall back if there is any PCL laxity. Then you ask the examinee to lift their foot off the bed, and when they do so, they engage, let it come back down, they engage the quadriceps muscles, and the first thing they will do is pull the tibia anteriorly again, and you'll see a clunk occur with a posterior cruciate ligament injury. I like to do my medial lateral laxity testing done in just a little bit of flexion, because then you can take the tension off the capsules and get a better reading of whether or not the collaterals are actually damaged. Also, what can be done is a Apley's compression test, which is done by flexing the knee and then putting it under pressure and then rotating the foot to see if there is injury or damage to either of the menisci. That is Apley's compression test. Another test that can be done to check the posterior lateral corner for any evidence of rupture or tear is to have the patient lay prone, about 45 degrees of flexion, and just see what kind of rotation they have of the knee on the fixed femur. So if they have significant amount of internal versus external rotation of the tibia proximally on the fixed femur, that would indicate that you have a posterior lateral corner instability as well.